The world is witnessing an alarming increase in the rate of Caesarean section delivery cases. Nearly every third child born is through a C-section. The methods for delivering a child are always a concern for the life of both the mother and newly born. Lately, the matter came to the forefront after the Odisha government decided to conduct the audit of C-section delivery cases. Now the question is, why was there a sudden need for a surveillance? The answer is the casual frame of mind in handling the birth of a child, which has led to a high rise in the number of C-section delivery cases in the state. Hello and welcome, I am Shreya and you're watching the Pamphlet. Odisha has reported a sudden rise in the number of C-section deliveries. As per the National Family Health Survey, in the past 5 years, the deliveries have risen from 13.8% in 2015-16 to 21.6% in 2019-21. These are some worrying numbers. As we look at the WHO's standard for C-section deliveries, it should vary only between 10 to 15%. On the other hand, Odisha's numbers even surpass the average delivery cases of India itself, which accounts for 21.5% of childbirths through C-section. Let us now take a little shift to see how these rising numbers are prevalent more in the private hospitals than the government ones. You would be shocked after looking at the huge gap between them. Private hospitals in Odisha account for 70.7% of delivery by C-section, while the government hospitals have reported only 15.3% of such cases. You must be wondering as to why there is such a huge gap of more than 50% in the delivery process of private and government hospitals. Well, the answers might be many, including medical standards, government regulation policies, health norms, or maybe the commercial factors. After talking to some doctors and analyzing the reports of some gynecologists, it came to our notice that India has no such standard set of guidelines as to how and when the doctor should carry out a caesarean delivery. The surgeons generally follow the standard medical norms of Federation of Obstetric and Gynecological Societies of India, which recommends opting for a C-section delivery only in cases of complications at the time of pregnancy. Nowadays, several women themselves opt for a caesarean child, but the safest delivery time as recommended is only between 37 to 40 weeks. This should be controlled, as a high C-section delivery in some way or the other is critical and life-threatening. It also has a direct impact on maternal and neonatal death rates, as has been clearly stated by WHO, that when medically necessary, a caesarean section can effectively prevent maternal and newborn mortality. This clearly gives a sign of warning that the countries should come up with safer delivery norms. Egypt, which is one of the countries with high C-section deliveries, came up with the reduction norms last year in 2022. Brazil in 2015 introduced rules for the doctors to verify the reasoning for each C-section procedure prior to the operation. Turkey also in 2012 passed a law limiting C-section to only those for whom surgery is a medical necessity. Among all these mitigating laws by developed nations on C-section deliveries, India too requires a standard set of regulations to be followed before going for a surgical operation, as unnecessary medical interventions can be harmful for both mother and child. Even a study in the Canadian Medical Association Journal has found that maternal deaths are 5 times more after a C-section delivery than a normal one. Recently, the government of Odisha has come up with C-section audit of delivery cases in private hospitals. The Chief District Medical and Public Health Officers will conduct an inquiry and submit the report to the Directorate. Such analysis will lay a foundation for creating future awareness. In 2017, a petition was filed in the Supreme Court seeking for effective guidelines on caesarean deliveries, but it was dismissed by the Supreme Court bench, terming it as an abuse of process of law. Another attempt to crack down on unnecessary C-section births was made in the same year by introducing a bill in the Lok Sabha called the Protection of Women from Unnecessary Caesarean Section Deliveries. The government has been showing willingness to mitigate the issue, but more such additional initiatives should be taken for sensitizing normal deliveries, improving awareness about obstetric dangers, postpartum complications, and ensuring that the private hospitals do not compel patients to get a C-section for just monetary benefits. Thank you for watching. If you liked the content, do like, share and subscribe to our channel, The Pamphlet.